Good morning. I'm here with Dr. Erica Brown, who's our local health authority for Harris County. With every day that passes, monkeypox is unfortunately becoming a bigger problem for our region. It's not all-consuming like COVID was, or in some ways perhaps is, but it's still in our hands to determine the trajectory of this virus. So today I want to have a very important conversation about what we can do to chart a different path. I want to share our current efforts, what we need the community's help with, and what we need from our partners, because there are certain pieces we just can't control entirely from Harris County. We must be very clear that there are specific tools we need if we are to prevent a large-scale outbreak. We only have one chance to stay ahead of this. The action we take today, right now, will determine what we face tomorrow. And that's why it's imperative that we take action while we're still early, while we can still make a difference and chart a different path. We're grateful for the nearly 17,000 vaccines that have been allocated so far to Harris County from the federal government. But it's my job to advocate for the community. The 17,000 vaccines were allocated after last week's request. They've not arrived yet. And when they do, they're not enough. Harris County needs a substantial increase in the number of monkeypox vaccines, and we need those vaccines now. The amount of vaccines allocated so far is not nearly enough to keep ahead of this virus, especially given the size of our population. Let me put that into context a little bit. Just recently, the CDC expanded their guidance to include people living with HIV as folks at high risk and folks that presumably should receive the vaccine. Here in Harris County, we estimate nearly 30,000 people living with HIV. If we were to increase eligibility based on current CDC guidelines, we'd need nearly triple the vaccines we are expecting just to serve this one group. And remember, every course, a full course, is 2 vaccines. So we're receiving 17,000 doses. Really is just half of that when it comes to the number of people. We've not yet been able to open up vaccines to that group specifically, those living with HIV, simply because of the lack of vaccines. In addition to that group, tens of thousands of other people are already eligible according to the CDC criteria. And many more should arguably be eligible given their at-risk status. Since launching our monkeypox hotline on July 20th, we've received over 4,200 calls. Right now, we only have vaccines for 250 more individuals, and that's only because we're keeping the criteria extremely narrow. We don't want to give people appointments and not have vaccines to give them. Our current capacity is for about 600 vaccines per week across 2 sites, but we have the capacity to ramp up to many more sites and provide many more vaccines, and we certainly have the experience of doing that with COVID. We're ready to go, we just need the vaccine. Because of our limited supply, our strategy will not prevail unless we get that resource. And we've seen just how quickly this virus can spread. In New York City and San Francisco, we've seen cases grow almost exponentially. Just yesterday, Governor Newsom declared a state of emergency in California. Governor Pritzker declared a state of emergency in Illinois. Here in Harris County, we now have 125 cases. Just a week ago, we had a bit over 50. Cases have increased nearly 120% since last Monday, when Mayor Turner and I had our joint press conference. They've increased 635% in the last 3 weeks. We can chart a different path, but we can't do it with how vaccines are currently being allocated, especially when our numbers are growing so quickly every day And that's why we must continue to call on the federal government to send us more monkeypox vaccines. It's the only way to keep moving in the right direction. I am hearing the anxiety, the fear, the concern from community members who want the vaccine and cannot get it. We hear that every day. Our public health team hears us, hears this. Our team here receives calls and messages from folks in the community who are at risk, who want to have access to the vaccine, who cannot get the vaccine because the criteria is so narrow, because we simply do not have enough of it to give out to the community that needs it. I need people to understand that we don't have an operational obstacle right now, okay? It's a supply problem, which we must correct. And the only way we're going to beat this is if we get more vaccines now. Because this is new for a lot of providers and for the community, I want everybody to know we are controlling what we can control. And so we're building this capacity to give vaccines, we're providing information to the community, and we're meeting people where they are. For providers, it's new to figure out how you take the test, how you send it to the lab, and so Dr. Brown, our public health department, are holding constant communications with providers, from hospitals to clinics and everyone in between across all our healthcare system. We're having those communications at least weekly. Keeping our community informed is important too, so we launched a community outreach and awareness campaign. We are making sure that those that are most impacted by monkeypox right now are fully aware of the resources available to them. There are weekly town halls, specifically with the LGBTQ community, as well as other efforts to reach specific communities and make sure that we do so all throughout the county. Today at Commissioner's Court, I will be joining our Public Health Department and urging my colleagues to support additional funding for Harris County Public Health to ensure operations are as strong as possible. So the minute more vaccines arrive, we're ready to give them. That means staffing, that means supplies, it means tools. We're controlling what we can control. As far as what the community can do, first and foremost, it's important to stay informed. We have resources at readyharris.org that links out to our public health website, and you can always call the hotline if you have questions. We have a monkeypox hotline. It's a dedicated line at 832-927-0707, and it's available in English and Spanish right now. I know we're working on other languages. If you feel you may have been exposed to monkeypox, or you have a lesion that you're not sure about, it's vital that you get tested. Providers should be able to give you the test, your provider, any clinic. If you don't have health insurance, if you can't afford the cost of it, you can call us at Harris County Public Health. We encourage folks to get tested. As far as vaccines, if you believe you qualify for the vaccine, please call us. We have limited supplies, I've made clear, but we want people to call so we can try and get them signed up. And it's the same phone number. We are coordinating closely with the City of Houston, so we make sure that we are balancing the supply across Harris County and the City of Houston. Let's keep doing our part to protect ourselves and our community. I will continue to advocate for more vaccines. I will continue to fight to make sure the operational opportunities are there. And we also need the community to help us with testing and with calling us if they qualify. So I'll repeat my remarks in Spanish and I'll pass it on to Dr. Brown for an update and to answer any questions. Con cada día que pasa, esta viruela del mono se está convirtiendo en un problema más y más grande para la comunidad. Todavía no es tan dominante como llegó a ser el COVID, pero sí es una preocupación que debemos entender. Debemos ser muy claros con el gobierno federal y con todos que hay herramientas que necesitamos para poder luchar contra este virus. Solo tenemos una oportunidad para cambiar la trayectoria de este virus, para trazar un rumbo diferente y asegurarnos que esto no se convierta en un brote de mayor escala. Ese momento es ahora mismo. La acción que tomemos hoy determinará qué vamos a enfrentar mañana. Por eso es imperativo que tomemos medidas ahora, que todavía podemos hacerlo. Dependemos totalmente en la cantidad de vacunas para poder trazar este nuevo rumbo. Agradecemos las casi 17,000 vacunas que el gobierno federal nos ofreció, puso a nuestra disposición la semana pasada, después de que pedimos un nuevo envío. Pero es mi trabajo abogar por esta comunidad. Esas 17,000 vacunas aún no han llegado. Cuando lleguen, no son suficientes para el condado Harris. Nuestro condado necesita un aumento considerable, significativo de vacunas para poder proteger a la comunidad y prevenir un brote a gran escala. La cantidad de vacunas que están a nuestra disposición en este momento simplemente no son suficientes. Un ejemplo, la CDC, el gobierno federal, ha expandido la semana pasada las personas viviendo con VIH, definieron que las personas viviendo con VIH deberían calificar para la vacuna. En el condado Harris tenemos casi 30,000 personas que viven con VIH. 30,000 personas por 2, 60,000, porque son 2 dosis para poder vacunar a una persona. Obviamente, ni siquiera las vacunas que vienen en camino son suficientes. De hecho, todavía no hemos expandido las categorías aquí en el condado para ofrecerle la vacuna a aquellas personas que viven con VIH, porque simplemente no hay suficientes vacunas para hacer eso. Fuera de ese grupo hay decenas de miles de personas que ya califican bajo las categorías que ya existen, que ya tenemos vigentes en el condado. No hay suficientes vacunas para aquellas personas tampoco. Desde que lanzamos la línea directa telefónica de la viruela del mono el 20 de julio, hemos recibido más de 4,200 llamadas. Hoy día tenemos solamente vacunas suficientes para 250 individuos más. Y eso es simplemente porque hemos mantenido los criterios extremadamente estrechos. No queremos darle citas a las personas y no tener vacunas que administrar. Tenemos la capacidad hoy día de ofrecer 600 citas semanales a través de 2 sedes de vacunación. Y tenemos la habilidad para aumentar esa capacidad de administración de vacunas dramáticamente. Tenemos toda la experiencia por el COVID. Pero por nuestros suministros limitados, esa estrategia no se puede aplicar aún. Simplemente no tenemos el material. Hemos visto qué tan rápido puede propagarse este virus. En Nueva York, por ejemplo, en San Francisco, solo el día de ayer, de hecho, el gobernador Newsom, el gobernador de California, el gobernador Pritzker en Illinois, ambos declararon un estado de emergencia. Hoy día tenemos 125 casos en el condado Harris. Hace una semana exactamente teníamos más de 50. Los casos han subido un 120% desde el lunes pasado, cuando el alcalde y yo tuvimos una conferencia de prensa conjunta. El incremento ha sido de un 635% en las últimas 3 semanas. Podemos trazar un camino distinto, pero no podemos hacerlo sin las vacunas. Escucho la ansiedad, el miedo, la preocupación en las comunidades más afectadas, lo entiendo. Y es por eso que estamos siendo tan agresivos al pedir más vacunas, porque quiero poder expandir esa elegibilidad, quiero poder vacunar más personas. Lo que quiero que todos entiendan es que no es un reto de operaciones. Tenemos las operaciones para administrar vacunas. El obstáculo es un problema de suministro. Estamos trabajando en las cosas que sí podemos controlar. Eso es, por ejemplo, la coordinación con los trabajadores de primera línea, con los hospitales y las clínicas, para que entiendan cómo se toma una prueba, cómo se envía la prueba a los laboratorios, qué deben estar buscando en los pacientes para identificar la viruela del mono. Estamos teniendo llamadas con ellos mínimo semanalmente. También hemos ya creado mínimo semanalmente reuniones comunitarias con la comunidad afectada, especialmente la comunidad LGBT, pero también incluimos comunidades a través de todo el condado. Hoy día voy a unirme al Departamento de Salud Pública a pedir más fondos para nuestro Departamento de Salud Pública para que puedan construir esa capacidad operativa para distribuir aún más vacunas en cuanto esperemos lleguen pronto. En cuanto a qué debe hacer la comunidad, lo que les pedimos es que nos ayuden a identificar el virus. Hágase la prueba, por favor. Su clínica, su doctor de cabecera debe de estar ofreciendo ya la prueba. Entonces, si siente que ha sido expuesto a la viruela del mono, si observa algo en su piel que sea un poco extraño, vaya al doctor, hágase la prueba. Si no tiene seguro médico o cuesta demasiado la prueba, llámenos y nosotros también se la podemos ofrecer. El número es 832-927-0707. No se pide ninguna información de ciudadanía o residencia. También puede buscar información en readyharris.org. Ahí tenemos toda la información de la viruela del mono. Si usted piensa que califica para la vacuna, y los criterios son muy estrechos hoy día, pero si piensa que puede usted calificar, llámenos también para que pueda recibir la vacuna. Es el mismo número. Si vive en la ciudad de Houston, estamos coordinando con la ciudad y también nosotros trabajamos con las ciudades fuera de la ciudad de Houston, pero aún dentro del condado Harris. Entonces vamos a seguir trabajando, vamos a seguir pidiendo estas vacunas. Espero que todos nos unan al pedirle al gobierno federal más vacunas ya. Y por mientras, háganse la prueba y llámenos si califica para la vacuna. Muchas gracias. Dr. Brown, do you have anything to add?
Thank you, Judge. One of the things that I would like to convey, as we have a very limited supply of vaccine at this time, one of the best things we can do as community members is to be mindful about the choices that we're making while we're waiting for additional vaccine. That being said, I encourage you to think twice before engaging in high-risk behaviors with multiple partners and or anonymous partners that you don't know. Again, as soon as we can expand our criteria and we have additional vaccine, we absolutely will. At this time, we just don't have enough for all who do qualify for vaccine. So again, I really encourage everybody to be vigilant and mindful about our individual actions and behaviors. Thank you.
We'll take any questions.
The pool, I have one question. It says, do you plan to declare monkeypox a public health emergency in Harris County?
Right now, it's not the moment for that, but that's obviously an option. And so we're watching the numbers. We're in touch with Dr. Brown and our public health team, and if it comes a time to do that, of course it's on the table. En este momento no estamos declarando un estado de emergencia, pero es una opción. Es una opción, es una herramienta. Entonces estamos en comunicación con la doctora Brown y con nuestro Departamento de Salud Pública, y si llega el momento de declarar una emergencia, lo haremos. So the rough estimate I have, and I want to make clear this may shift as needs are assessed, around $2 million for staffing, for equipment, generally the tools that we would need to test, vaccinate, and do these various events like the town halls, visiting with providers, etc. But part of the item will be let's have an ongoing conversation so public health has the funding that they need. Do you have anything to add on that, Dr. Brown?
Some of the funding will also go to, if approved, would go to contact tracing, and that's where we've identified an individual who has monkeypox and reach out to that circle of people that they may have come in contact so that we can mitigate the spread. That's something that's very, very important to help us keep the spread low in our community.
Can you elaborate on why you think it is you have a shortage of vaccine? Why? Like, are other people getting it? Is there not enough being manufactured?
Right. I see what you're saying. So from our observation, it's not that people who shouldn't get the vaccine are getting it. And we have to remember right now, the virus is affecting a particular community, but we can't make the same mistake we made, for example, with HIV and AIDS and assume that it cannot be transmitted to everybody else, because it can. The issue that we see is we are simply not receiving enough quantities from the federal government. That's the issue. And
they're sending it elsewhere. That's what I'm trying to get clear. Are you saying they're sending it elsewhere?
I see.
And we are unique in that.
Look, I've spoken with some colleagues around the nation. Everyone that I've spoken to is seeking more. Other communities that have even more spread are receiving more vaccines than we are. But my point is this. If we follow the exact same trajectory that these other communities have followed, we're going to end up in the exact same place. And that means uncontrolled spread. And so what we're trying to do is recognize that we can take stock right now, and that we have that tool right now. We have an FDA-approved vaccine that has existed for many years that can keep this virus from spreading. And so the time to vaccinate enough people is now. It is not when we have a state of emergency and the virus is completely under control. So what I'm trying to convey to our partners in the federal government is, let us chart a different path. Give us a chance of success with this virus because we have an opportunity. Now, they have supply problems. Why they haven't sent more, I don't know. But that's why I'm being very, very clear in my ask and in my advocacy. And the truth of the matter is, we need a lot more vaccines in Harris County right now.
Judge, what are we saying to those, or what's being done at this point in time for people who are calling who do have anxiety to say, I need this and I need it now? What's happening with them at this juncture?
Yeah, I mean, look, we've even heard of people who say, I'm going to try to get it in another jurisdiction. But the truth is, the jurisdictions that have more vaccines also have more cases. So, you know, from what I hear, we're all sort of hamstrung. It's a difficult conversation, right? If you have someone who has a close contact, if you don't give them the vaccine while at the right time, then later is sort of, it's too late. Or if they're just beginning to develop symptoms, you can't wait very long. But look, there's no easy way to put it. I mean, you either have enough or you don't have enough, and so it does mean that some people are just not going to get it who would if we had more availability. That's also part of the reason we're keeping the criteria so narrow. So if right now, for example, we were to open it to everyone who is living with HIV, we would be turning down so many people. And so, you know, it's a decision that we're making and reevaluating every day. But we're saying we would rather keep the criteria narrow and focus on that very, very narrow set of people, and then have to turn people down all the time. But of course, people do call us, you know, who say, hey, I'm living with HIV, and whether the answer is we don't have enough vaccine, or you don't qualify because we don't have enough vaccine, and we've narrowed the criteria because we don't have enough vaccine, it's just as heartbreaking, and it's very difficult to see every day go by when we know we could be making a much bigger dent in this virus. Do you have anything to add, Dr. Brown?
Thank you, Judge. I do want to clarify as well that those who are living with HIV who do meet the criteria are eligible. The criteria being having had direct exposure to someone with monkeypox, engaging in sex acts with multiple partners, or parties in bathhouses, etc. Those who have had gonorrhea or syphilis in the last 3 months, and any HIV patients would not be on PrEP, but anyone who is on PrEP as well. So those who have HIV who are in our limited criteria, they do meet criteria.
And just to clarify something for the public, does everybody need to be vaccinated at this point?
Not at this time. So there's no indication that the general population needs to be vaccinated. The spread of this virus is very specific in that it is direct contact. And so to my point earlier about being conscious about the decisions that we're currently making to help to mitigate the spread as well is extremely important, as again, the spread is direct contact. And so the general population at large, unlike COVID, where the spread was in the air, it doesn't work that way.
And is there specific populations or anything, like somebody that might have traveled to Asia or something like that? Are those people need to be more vigilant about spreading this or being?
Not necessarily. So the virus, monkeypox virus, is endemic in parts of Africa. But again, even with it being endemic in parts of Africa, it's still through direct contact.
Can you expand on the prioritization or decision-making process of who is being chosen for the vaccine right now versus wait?
Sure. So the prioritization is based on and is being used, frankly, as a proxy to provide vaccination to vulnerable populations who are engaging in high-risk behavior, frankly. So again, we are very, very clear that there are many who qualify for the vaccine just as because they're immunocompromised and for some other reasons. But right now, because we have such a limited supply, we had to determine a mechanism for who is most at risk, and the key there is most at risk. It doesn't mean that we don't acknowledge there are others who are at risk, but because of the limited supply, we had to narrow it to who is most at risk.
And to be clear, also, these are based on the CDC guidelines, and so
Yes.
what the CDC said folks who have contact with somebody with monkeypox, so we have that. Those who've attended an event with high risk of exposure, so those are group A, and then group B is the folks diagnosed with gonorrhea or syphilis in the last 3 months, folks on PrEP. And we would like to, as they suggested, they said folks HIV positive, but as you saw, we've almost 30,000 people, 60,000 doses, and right now we only have enough doses for 250 people, so we would just create a mad rush.
And is there a waiting list for this?
So right now, what I was trying to explain earlier is the number one priority is the folks who have come into contact, and so that there's no point in having a waiting list for those folks. And then the other groups are narrow enough that we have people scheduled, and we'll schedule them out until we run out of those last 250, and then we'll probably have some sort of waiting list.
And is there any difference between the sign-up process that y'all did from COVID to monkeypox?
Yes, it's different right now. I know it's not the most convenient, but our supply is so limited that this is the best way operationally to do it. So with COVID, we had you could do it via phone, or you could do it online, and it was a randomized system. With this one, it's only via phone, so we can better exchange the information between the city and the county. And it's basically, if you meet the criteria, it's first come, first serve.
Judge, can you give us any kind of a breakdown on the patients that we're seeing right now? That confirmed 125 cases. It was predominantly men. Last check, is that still the case?
Yes, we're still seeing very much predominantly men. I know we had someone hospitalized. I don't know, Dr. Brown, if you have an update on any more severe symptoms. We don't have any more updates at this time. We do have to start court soon, so maybe I'll take one more question. Yeah.
Sí, en español, por favor. Si yo soy una madre de familia viendo esto a las 5 de la tarde, debo estar preocupada de que la viruela cínica se puede convertir otra vez en una epidemia, tal y como ocurrió. Hablábamos en enero, febrero del 2020, que había 20 casos en el condado Harris, después que es 40, dice que se ha aumentado de 50 a 125. Debo estar preocupado de que esto se va a convertir en una epidemia también y después posiblemente una pandemia. Dice la doctora Brown que en África es endémica. Entonces, ¿qué va a pasar si no hacemos algo?
Miren, nadie puede ver exactamente el futuro. Lo que más nosotros podemos predecir es, este virus se puede controlar. Es distinto al COVID porque tenemos la vacuna ya. Es como si en enero, febrero, marzo del 2020 ya hubiéramos tenido vacunas y ya hubiéramos tenido suficientes pruebas. Esa es la otra diferencia con este virus. Hay suficientes pruebas. Si recuerdan, con el COVID no podíamos siquiera identificar las personas que tenían COVID. Entonces, lo que esperamos es que con las pruebas y a medida que recibamos más vacunas, que vayamos a poder controlar este virus antes de que se convierta en algo tan drástico como el COVID. Lo otro que es relativamente bueno es que los síntomas y especialmente el porcentaje de personas que mueren debido al virus es mucho más bajo que con el COVID. Ahora, eso no significa que no nos preocupemos. Especialmente en niños, el virus puede ser un gran problema. Puede crear infección en el cerebro, puede crear otras infecciones. También personas con nivel inmune bajo. Entonces, ese momento deben preocuparse, no, ocuparse, ¿ok? Ocuparse en, si ven alguna cosa extraña en la piel, háganse la prueba. Si su familia califica para la vacuna, llámenos. Y acompáñenos a pedir más vacunas por parte del gobierno federal. A medida que recibamos más vacunas, vamos a poder asegurar más y más que este virus no se vuelva un tema más serio para la comunidad. Okay.
Judge, real quick, you've mentioned community several times. We know our community is larger than Harris County. Will people that live just outside of Harris County be eligible to get the vaccine through Harris County?
So all of the jurisdictions are receiving vaccines, and other public health departments should have vaccines to distribute. I would urge folks outside the county to check with their local public health department first. But of course, as we receive more vaccines, the idea is we're all tied. We're all tied. We're all tied together. All right, thank you so much.